In this video, I'd like to discuss California's Proposition 1 in 2024, also known as the combination of Senate Bill 326 and Assembly Bill 531. So, the path for this proposition on the ballot began with Senate Bill 326, which was introduced on February 7th, 2023. Then Assembly Bill 531 was introduced on February 8th, 2023. Senate Bill 326 passed the Senate May 24th, 39-0. Senate Bill 326 passed the Assembly September 12th, with 68 in favor, Democrats and Republicans, and then 7 Republicans against. Assembly Bill 531 passed the state Senate September 14th, 35 votes in favor, Democrats and 7 Republicans, and 2 Republicans against. Assembly Bill 531 passed the Assembly September 14th, with 66 in favor, Democrats and some Republicans, and then 8 Republicans against it. The bills were signed into law on October 12th, 2023. And when they were signed into law, there were some small changes, but really the idea that this was going to the ballot. The election result was very close. There's a chance for updates of votes, but the race has generally been concluded as over, and for the people who did want these changes to behavioral health laws. So the yeses on the proposition had 3,617,586 votes. These numbers have changed a little since, but this was true at the time of recording. With Los Angeles, Santa Clara, Sacramento, Alameda, Contra Costa, San Francisco, San Mateo, Sonoma, Solano, Marin, Santa Cruz, Monterey, Yolo, Humboldt, Napa, and Mendocino counties being in favor of the changes. And then the no votes had around 3,588,274 votes. The first change that the proposition brings is changes to county behavioral health boards. It requires one member of each county's behavioral health board to be an employee of a local education agency. County behavioral health boards are to review, evaluate, and advise on substance use disorder services which are being provided by the county. The State Department of Healthcare requires counties to use funds for adults and older adult substance use and disorder treatment services, to provide services, or there's now an option to provide services for first episode psychosis, which was not prohibited earlier. Services can also, or are to also now include people who are at risk of incarceration. Counties are to conduct a comprehensive assessment, create a plan for services, and assist in receiving services. And counties are to submit claims for behavioral health services which they provide. Another thing the state is now having counties do is to provide housing interventions. Some of these housing interventions include rental subsidies, operating subsidies, shared housing, family housing, and capital development projects, as well as project-based housing. County early intervention programs, something which counties are to have, include outreach regarding signs of mental health illnesses and substance use disorders, access to medically necessary care, mental health and substance use disorder services, and the state is to provide a biennial list of practices for children and youth, and counties are to provide training for school employees and identification, intervention, and referral of students with mental health and substance use disorder needs. The State Department of Healthcare really wants counties to work on early intervention priorities. Something new in the law now, with the passage of Proposition 1, is the outreach and engagement strategies for early childhood residents. There's changes now to the State Behavioral Health Services Oversight and Accountability Commission. It is now expanded to 27 members. These members include the Attorney General, Superintendent of Public Instruction, a Senate representative, an Assembly representative, and 23 representatives appointed by the governor. And there's an executive director as part of this commission. The commission meets at least once a quarter, creates and writes a report that includes recommendations for improving and standardizing promising practices for Behavioral Health Services Act programs, and it oversees the Behavioral Health Services Act Innovation Partnership Fund, which has $20 million to give away between 2026 and 2031 for programs which help behavioral health services. The county full-service partnership programs include mental health services, assertive community treatment, except in counties with less than 2,000 residents. There is a way to get around this. There is now to be assertive field-based initiation for substance use disorder treatment services, outpatient behavioral health services, and housing interventions, as mentioned earlier. That is included. The housing interventions is included with the full-service partnership programs. The Mental Health Services Fund distribution in counties for 2025 and next year is to include 20% for prevention and early intervention programs, 5% for county mental health programs. Beginning in July 2025, 2% can be for improving plan operations, quality outcomes, fiscal and programmatic data reporting and monitoring of subcontractor compliance, and funds from the state which are given to the counties for these purposes are to go into local mental health services funds. Beginning in 2026, the fund, what is to be funded from in the counties is going to change. 30% is to go to housing interventions. 25%, up to 25% of that 30% could be for capital development. 35% is to be for full service partnerships, and 35% is for additional programs, which includes 5% of that is to go towards an annual planning cost, 2% or up to 4% for counties with less than 200,000 residents can go to improving plan operations, quality outcomes, fiscal and programmatic data reporting, and managing subcontractor behavioral health program compliance. 51% of that is to go to early intervention programs, and 51%, or at least 51% of that 51% is to go to early intervention programs for individuals 25 and under. 4% of the additional funds is to go towards population-based mental health and substance use disorder prevention programs, and at least 51% of that 4% is to go towards those programs for populations 25 and under. Around 3% of those additional funds for counties is to go towards the behavioral health workforce initiatives in the counties. There is to be a Behavioral Health Services Act Revenue Stability Work Group, which will begin no later than June 30th of 2024. Which is to develop and recommend solutions to reduce Behavioral Services Act revenue volatility and to propose appropriate prudent reserve levels. It is to include representatives from the Behavioral Health Oversight and Accountability Commission, the Legislative Analyst's Office, the California Behavioral Health Directors Association of California, and representatives from urban and rural counties. Each county is to create an integrated plan for behavioral health services and outcomes every 3 years. Is to demonstrate how each county will deliver behavioral health services. It is to demonstrate how people who are experiencing homelessness, who may experience homelessness, people who are incarcerated, who have been incarcerated, or who may be incarcerated, and are in child or adult protective services will get needs met. It is to demonstrate how a county will invest in early intervention and behavioral health innovation. And it is to also demonstrate how the state will maintain a robust behavioral health workforce. Other inclusions for this plan is to include development process with local stakeholders, a set of measures to track the process of what the counties are working on, is to include work with county Medi-Cal managed care plans to adopt population needs assessments. There are to be plans. These plans, which counties create every 3 years, are to be submitted to the Behavioral Health Oversight and Accountability Commission. County Board of Supervisors are to approve these plans by June 30th. And counties are to identify behavioral health disparities and develop approaches to eliminate them. And counties are to also ensure that contractors meet non-discrimination standards and hiring practices. Some considerations that are to go into creating these plans are the prevalence of mental health and substance use disorders, the unmet need for treatment, the homeless point-in-time count, and in each plan there's to be a description of the data sources which are considered to create the plan. Involvement of the plan, there is to be involvement from local stakeholders, which includes in counties with less than 200,000 residents, the 5 biggest cities are to work on the county plan. Draft plans are to be circulated for review at least 30 days before approval. Prior to the approval of the plan, a public hearing is to be conducted. The Behavioral Health Board will review the county plans, and if counties are to update plans, these plans should be on the website for 30 days for public review to be able to get further input and feedback from the local community. The County Behavioral Health Outcome Accountability and Transparency report is to be done every year. Is to include workforce vacancies, the county employees providing direct clinical behavioral health services, and this report is to be published online. There's also to be a report of the progress of the Behavioral Health Services Act. Now, the first report's to come at least by 2029. It could come earlier, but every 3 years until 2035, from the year of the first report, there's to be a new report. It's going to assess the state implementation of the act. Um, how well is the state implementing the act, and what's the impact on behavioral health? County programs, how well are county behavioral health programs at meeting residents' needs? The inclusion of substance use disorders is the inclusion in the behavioral health act with substance use disorders helping. What are the changes? Are substance use disorders decreasing? What impacts does the inclusion of the Behavioral Health Act of it bring along? And then the financial aspects of the Behavioral Health Act and all the changes which have come with it. The main part that a lot of people thought about when I guess voting for this, and the large parts of the proposition was the bonds which were created. $1,065,000,000 for conversion, rehabilitation, and construction of new permanent housing, which is to be for general groups, and $922 million for conversion, rehabilitation, and construction of new permanent housing for individuals experiencing homelessness or at risk of experiencing homelessness who also have a behavioral health challenge. So individuals experiencing homelessness or are at risk of experiencing homelessness can qualify for the new permanent housing. The over $1 billion of that, even if they have a behavioral health challenge. But there are more groups that could apply for that funding. The $922 million are specifically for these groups, individuals experiencing homelessness or who could experience homelessness and have the behavioral health challenge. There's also to be $1,500,000,000 for local long-term behavioral health treatment operations. This won't just go directly to counties. Immediately, this will go to counties when there are ways that these counties have shown they can help their local residents with behavioral health treatments. And there's to be $2,893,000,000 for state long-term behavioral health treatment operations. This is to more go towards wherever the state rather than just in counties. It could be in counties, but it's mostly to where the state can find that the residents of the state can be improved with more behavioral health support. Where can all this money be used to help the state's residents? That's what that part of that bond is for. And then there are behavioral, or that part of the bonds which are being issued. And then there's the Behavioral Health Infrastructure Bond Act Finance Committee, which includes a treasurer, which is the chair or the leader of this committee, the controller, and the director of finance, who also sit and have a position on this committee.